Welcome. My name is Barbara Markham. I'm the Director of the Senior Resources Department for the City of Westland. With me today is Dr. Michelle Akler, ophthalmologist. Thank you, Michelle,
for having
coming
me
today. Tell us a little bit about you.
I am a medical doctor and I'm specialized in ophthalmology, which is the medical and surgical care of the eye. I've been in practice for 13 years and I'm in Dearborn, Michigan.
Great. I've talked to a lot of seniors and a lot of people in the community, and with an eye exam, people are driven to the doctors when they have symptoms, if it hurts, if it's, it seems abnormal, but there are so many different things that can be happening with the eye that people are basically unaware of, and they don't frequent the ophthalmologist's office as often as they should. Let's talk a little bit about that.
You're right, Barb. There's a lot of patients in the community and there's a fear of having their eyes looked at. One aspect is what you talked about, that people they feel like they're seeing well, they're getting their cheaters over the counter from the drugstore, so they feel like if they can see that they're good. But as we all get older, there's certain eye conditions that become more common, like glaucoma and macular degeneration, as well as cataracts. And if we can screen for these conditions, there's things we can do to treat them and to prevent vision loss. And I think that's what a lot of people don't understand, is that it's really important over 65 to have a screening eye examination once a year to screen for these conditions that potentially can damage the vision but are very treatable, especially if they're detected early.
Great. Well, let's talk about glaucoma first. I have a genetic predisposition. My dad has macular degeneration. My mother has glaucoma. I haven't been to have my eyes examined in probably 15 years. So we've arranged to do an on-the-road show with you to give our viewers an opportunity to see what we go through, for an eye exam. But let's go with glaucoma first. That is a condition. Does it show up at any age during a lifetime, or is it specific to older adults?
It can show up at any age, but like many conditions, it's much more common the longer we're alive. So that's why I think it's wonderful that you're taking your health into your hands and you're going to come and see us, and we're going to show everybody that an eye examination is painless, it's not scary, and so much valuable information can be learned.
What is glaucoma exactly?
Glaucoma is a condition where the pressure in the eye runs higher than normal, and over time, and it's usually over years, it damages the nerve in the back of the eye, which causes a loss of side vision. If it becomes very advanced, it can be a condition where you can completely lose your vision. But again, it's very treatable with either eye drops or with laser procedures to make the eye pressure lower. And again, people don't feel it when their eye pressure is mildly to moderately elevated, and that's one of the key conditions that we screen for when we do an eye examination.
What is a normal pressure? What are the ranges?
The normal range is from 10 to 21 millimeters of mercury. So anything over 25, we always will treat, even if there's no sign of damage to the nerve, because we don't want to wait. We know from our studies that if we don't treat that, if we wait, there will be issues later.
Okay, Dr. Akler, how do they test for glaucoma?
We check for glaucoma by using a handheld instrument. What we do is we place a numbing drop in the eye, which burns just for a second when it goes in, but then the eye feels heavy and you can't feel anything, and then we gently touch the surface of the eye, and that's how we determine the eye pressure.
Okay, and if the pressure is too high, what are the two ways that it's treated?
If the eye pressure is high and we feel like there's either glaucoma or a high chance that it's going to progress to glaucoma, what we want to do is lower the eye pressure. So the two ways of doing that are either using eye drops in the eye, and the minimum dose of the eye drops is at least once a day. And it is a lifelong commitment. So it's not like antibiotics where you can take medication for a week and then be cured. With glaucoma, you need to be on the drops every day.
Okay, if you're on the drops, is there, or say there was no laser procedure, if you've been on drops for say 10 years, can you have the laser procedure done after that, or once you're on the drops, you have to stay with the drops?
Barb, that's a great question. You can have the laser procedure at any time, either if you've never been on the drops or even if you've been on them. What it is, it's an in-office procedure where we use the laser to make tiny microscopic holes in the part of the eye that drains the fluid, and that helps the eye move the fluid out more efficiently, and it drops the pressure.
So is it the fluid that causes the pressure?
It's just that the eye, usually the eye is not draining the fluid as efficiently as it's producing it.
All right.
So,
Well, what happens when glaucoma goes untreated?
untreated glaucoma over time, it causes loss of the side vision, and if it continues to be ignored, eventually the central vision can be lost. And unfortunately, I've seen many patients who either are just ignoring the fact that they know they have the glaucoma and they aren't treating it, or they didn't realize anything was wrong. And when they come in with a lot of loss of the side vision, it's very difficult to manage because we can't undo the damage that's been done. All we can do is prevent further damage.
Out of curiosity, is it possible to have glaucoma in one eye and not the other?
It is. It's more unusual, but there are certain forms where it can heavily affect one eye and not affect the other eye.
Okay. What is macular degeneration?
So macular degeneration is a condition, again, it's much more common as we all are alive longer. It affects what we call the retina, which is the back of the eye. And basically, the damage occurs to the part of the eye that you need for your central vision, which is like your reading vision. There's two forms. The dry form is by far the most common. That's what about 90% of people have. And we see findings in the retina, and people usually have either a mild or moderate loss of vision. With the wet form, abnormal blood vessels can grow in the back of the eye, and they can leak fluid or bleed into the back of the eye, which can cause very severe loss of vision.
And how do you test for that?
What we do is we do an examination where we do some basic things like check patients' vision, get their history, and then we dilate the pupils, which means put drops in to make them larger so we can examine the retina with our special lenses. We can usually see the signs of either wet or dry macular degeneration. We also have a digital test that, again, it's painless. It's something that takes a picture in the office that allows us to see if there's any fluid present to screen for the wet form of macular degeneration.
Can the dry turn to wet?
It can. And if it's happened in one eye, it's about a 50% chance that over time the other eye may have the same thing. So getting back to why it's so important to have the eyes checked, a lot of patients, they're terrified to go to the eye doctor. Even if they think something may be wrong, they're so scared that they're going to find out that they have something like macular degeneration, that someone's going to call the Secretary of State and tell them they shouldn't be driving. But the truth is, even if there is some mild form of macular degeneration, we give patients visual things to look at home to help them screen themselves for progression to the wet form. And it's really much better to know there's a problem and to know what the symptoms are to look for if things should get worse than to just wake up one day and, not be able to see out of one of the eyes.
Can that happen?
It can.
Okay, so with the macular, it is, those are blood vessels, abnormal blood vessels in the back of the eye?
In the wet form.
In the wet form. And that's probably the worst.
Usually, it can cause very devastating loss of vision, but again, it's much more treatable than it used to be in the office. The results are much better, but it's also one of those situations where we'd really rather know early on if the eye is starting to convert to the wet form. It's much more treatable the earlier we get to it.
Okay, and with the glaucoma and macular, if you have a family history of that, are you more prone to have it?
You are. It doesn't mean that you 100% will, but with the family history, it's more likely.
Okay. Another thing I'd like to talk about is diabetes and the effect that diabetes has on the eyes. What can you tell our viewers who are diabetic, and how important is that to get into your doctor?
Diabetes is a chronic condition that's becoming more and more common, again, as we all age, and in America in general.
Yes.
And it can severely damage the vision. With diabetes, it's critical to have a screening eye examination once a year. And one of the things I want to touch on, because this is really makes a lot of people confused, is if you're a diabetic, that's a medical condition and that's a medical eye examination. It has nothing to do with your vision insurance, because people, a lot of the time, their vision coverage may not exist and they're worried, well, am I going to have to pay for it? But it's a medical condition and it's critical that your eyes are examined every year. And everyone's family doctor should be encouraging them to have screening examinations once a year. Because again, with diabetes, if there's early signs, they're very treatable. But if the diabetes is out of control in the back of the eye, it's much more difficult to get vision back than to preserve the vision in the first place.
Well, what happens to the eye when someone is diabetic? How does the diabetes actually affect the eye?
What it does is it affects the blood vessels throughout the body, but because in the eye the blood vessels are very tiny, they tend to be very affected by diabetes over time, especially if the sugar is not controlled. They can make little hemorrhages in the back of the eye. And the commonest cause of visual loss in diabetics is where the blood vessels become abnormal and they start to leak fluid into the back of the eye. And this condition is treated with either injections of medications into the eye or with in-office laser treatment for the eye. The blood vessels also in very severe diabetics can grow abnormally and rupture and bleed and cause detached retinas. That's a much more severe situation.
And so how is that treated over a long period of time?
Well, we start with the screening eye examinations. If abnormalities are detected, we will do testing in the office. One of the more common tests is called an angiogram. It's done in the office. We inject dye in the arm and we photograph the eye as the dye is circulating. And the nice thing is it's all digital, so we can show the patients immediately what's going on and what the treatment recommendations are. The commonest treatments are either injection of medication into the eye to reduce the swelling and the amount the blood vessels are leaking, or laser treatment to seal off the blood vessels.
And how successful is that?
The treatments work really well. Again, the earlier we get to the bottom of what's going on. So the longer the patient has been suffering with the visual loss, or the longer the diabetes has been out of control, the harder it is to treat. But most people do quite well with treatment, especially again if the detection is early before the diabetes has caused a lot of damage.
And if it goes untreated, can they lose their vision?
Yeah, it's one of the leading causes of blindness in the United States.
Okay, so that we want to make sure our viewers know that that's a really important reason to go in and see the eye doctor.
Yeah, absolutely.
With presbyopia, which is the natural progression, the aging of the eye, which I think you start seeing those changes at about 40.
That's about right.
Yeah, where the cheaters are very important to daily functioning. What happens with the natural aging of the eye? What changes?
What happens is that the lens, which sits inside the eye, as we all get older, it just gets stiffer and it's less able to bring the focus from distance to near. And that's why you're right. At some point after age 40, we all begin to struggle with seeing well up close until most people break down and have to go get the cheaters. That doesn't mean that there's anything wrong with the eye. That is a natural situation that happens. The more we are over 40, the more dependent we're going to be on the reading glasses.
Now, if the lens is more rigid, does it get to a certain point where you progress from the 1.50s to the 1.75s to the 2.0s? Does it stop at any particular, or does it continue to get worse as people get older?
Now, it usually does stop. Usually, when you get up to a 250 or at the highest a 3, usually
that's as bad as it's going to
get.
Okay, now they have like the LASIK treatment, which is for something entirely different. Is there anything that they can do for the natural aging of the eye at this point?
It's a much more difficult problem to treat than getting rid of glasses for, for example, nearsightedness. But there are some treatments, especially as we all get older, when people develop cataracts, which is where the lens not only is stiff, but it can turn cloudy and affect the vision. There are specialized implants that we use at the time of surgery that can correct both the distance and the near vision.
Okay, so can you test for that during regular cataract examination?
Right, it's part of our routine eye screening is to screen for cataracts, which cause a gradual, painless loss of vision, and they can give you glare at night when you're driving. Usually just everything is just getting blurrier and blurrier, and most patients go to the doctor, they think it's their glasses, they get the glasses changed, and it's exactly the same. That's usually how
I've
you
talked to
know.
a lot of seniors, and they said after the surgery, it's amazing. Colors are brighter, their vision is dramatically increased, and it's because it's so gradual as it goes along. They don't realize what they're missing.
That's right. They keep adapting, and then usually they do hit a wall. But the surgery, it's so the result is so immediate compared to the years that the cataracts have been growing that it is very dramatic.
Yes, I was very surprised when they said it's like night and day, literally. Now what other diseases of the eye you tend to see as people get older? Is there anything else that seems to plague the older adult population?
The one topic that we haven't touched on is dryness in the eyes, and that's another situation where, you know, the longer we're alive, you know, the body doesn't produce as many tears, and people tend to get dry eyes, which causes irritation, burning, feeling like there's sand or grit in the eyes. And the commonest initial way we tell patients to manage it is to use over-the-counter, they're called artificial tears. You can buy them at any drugstore to lubricate the eye. If that doesn't work, and many patients come in and they're very frustrated because their eyes are bothering them all the time, there's other treatments we can do in the office. There's medicated eye drops. We can also place little tiny plugs, the way you would put a plug in the drain of your sink to make the fluid level higher. We can put little plugs in the corners where the fluid drains out of the eye, and that often will really help relieve people's symptoms. And I think a lot of patients just think that this is just one of the things they have to live with, but often there is a lot we can do to help them manage their symptoms.
Well, I think you're very right when it comes to seniors being afraid of those eye exams and afraid that if they don't see well, that they won't be allowed to drive and they'll lose their independence. And that's why one of the reasons why I wanted to do the On the Road show and this show with you, because the earlier you detect any kind of problems with the eyes, the better they fare, you know, in the long run. Is there anything that you'd like to say to the viewing audience before we close?
I think you've touched on the key thing, and when we do our On the Road show, we're going to take all the mystery out of the eye examination. People are going to see that it's not scary or painful, and it's going to be very unusual that we're going to tell the patient some devastating news that they don't want to hear. It's just critical to get your eyes screened yearly when you're over 65 to make sure that you don't have these conditions. And most of the time when people come in, they just leave with a sigh of relief knowing that their eyes are healthy.
Absolutely. Your office was present in our Senior Health and Resource Day, and we do cover as many areas with health and resources as possible. So we do have literature available on those different eye problems at our office, at my office from yours. And so if anybody's interested in seeing those, they can stop by, and I do have those available. And then they can also watch when we do our On the Road show. I'm excited to do that, where we'll be going for an exam and they can see exactly what it's all about.
That's looking forward to it.
So, Mike, thank you so much for being with us today.
Oh, thank you for having me.
Sure. And thank you and the viewing audience for being with us also.